Good evening and welcome again to Montgomery Heart and Wellness. And I have a wonderful topic for you tonight. We're going to be talking about hypertension. I've been seeing so many patients come into my office with blood pressure that's very difficult to control. Now, granted, I'm a cardiologist and I see lots of patients with hypertension, and it's common. However, it seems to be sort of an epidemic of people with malignant hypertension and people with hypertension that was previously controlled that's no longer controlled under current medication. So this topic is going to cover some major issues. One, we're going to get into the details mechanism. What is the underlying cause of what we talk about as essential hypertension? That's number one. Number two, I'm going to talk about why essential hypertension is so difficult to treat with medications. And if you stick around, I'm going to give you bonus information regarding how you can start a nutritional detox program, and it can help you not only control hypertension, but other chronic illnesses. So hypertension is a very, very common problem. Many of you are taking medications, and we're going to cover the underlying concepts of why hypertension is hard to control and why some of your medications may or may not be working effectively. So let's get into this very important topic. Now, hypertension cause and solution. I'm going to warn you, there are going to be a few slides that are going to get into some details. If you don't have a science background, I'm going to make sure that you understand this information. But let's start off with what is hypertension. Essentially, chronic sustained increased blood pressure above 140/90. That's when we officially give you the diagnosis. Now, I'm going to comment on the fact that people can have the underlying cause, a biochemical cause of hypertension, even before the blood pressure is elevated. But this is the official definition. Essential hypertension is about 90 to 95%. There's a small percentage of hypertension that's about 5 to 10% that's secondary to some other cause. For this discussion, we're going to be talking about essential hypertension. That's going to be the cause is multifactorial, and we're going to get into some of those factors. So let's talk about the overview of the mechanisms of high blood pressure. Essentially, it starts with environmental factors. Primarily, it's your lifestyle and things that contribute to it. So your lifestyle contributes to cellular micronutrient imbalances. These are the electrolytes and things that are inside the cells that it contributes to cellular dysfunction. It then leads to systemic biochemical reactions that spread throughout the body. Then that affects your nerves, your neurohormonal system. So hormones become unbalanced, and then it gets to the level of organ and tissue dysfunction. So at the very core of things, cells become imbalanced because the micronutrients in the cells become imbalanced. This has a lot to do with the things that you're ingesting. And that leads to further dysfunction of the cells, which leads to further spread of chemical reactions throughout the body that affects how the endocrine organs and other organs communicate with each other. And then it leads to organ dysfunction. And then you start to have things like high blood pressure. So these different mechanisms interact with each other on an ongoing basis. Let's talk about the basic lifestyle factors. We often know about diet. Everyone thinks, okay, low sodium, low sodium, low sodium. But, smoking, of course, gases that you're taking in, things that you're breathing, toxic beverages, alcohol, processed sugary drinks, etc., toxic solid foods that you may be consuming. So excess toxin congestion or intake leads to these biochemical imbalances, and the inadequate consumption of healthy foods, inadequate outdoor exposure, inadequate hydration, and of course, inadequate intake of solid food consumption, inadequate plant-based food consumption, and the like. So these lifestyle factors leads to the complex biochemical imbalances. Now, the first time you smoke a cigarette or drink a sugary drink or drink alcohol, you don't get blood pressure necessarily, but this is a process that builds up over time. The first time you skip out on hydrating, etc., it won't give you hypertension, but these things build up over years and decades to lead to the biochemical imbalances. What other lifestyle factors? Well, insufficient movement. We generally lead sedentary lives. Most of our work, we're not farmers, we're not hunters. Most of us work in sedentary environments. The lack of lifting, climbing, running, walking, we have to make a conscious effort to exercise. Again, these things lead to contribute to the cellular imbalance. And other lifestyle factors deal with the toxic social environment many of us are in. The things that we read or that we see, that we hear, the people we associate with. Again, these things all contribute to cellular dysfunction. So it's not just what you eat, it's what the lack of movement, lack of outdoor exposure, and the people you're exposed to. So let's look at some of these micro and macronutrient imbalances in detail. Again, I said some of these slides will be a little bit complex, but let me just simplify this one for you. The micronutrient and mineral environment basically deals with minerals and vitamins. If you're not consuming adequate minerals, adequate vitamins, or the foods that you're consuming are unbalanced, so let's say you eat something out of a can that has dyes and other chemicals in it, they have lots of toxic chemicals and they have inadequate other chemicals. Now, we all know about high sodium intake, but also low potassium. Lots of foods that we consume are low in potassium, have inadequate copper and other types of nutrients that are necessary for blood vessel health. So this imbalance inside the cells lead to the next level of macronutrient imbalances that we're bringing in toxic things that causes what we call reactive oxygen species and oxidative stress. What is that? That's just toxic waste. We're consuming chemical toxins. Again, yellow dye number 40, red dye number 6. These toxic chemicals come in and they cause oxidative stress. And these oxidative stress are unstable compounds that float around. They damage DNA, they damage cell membrane, and they cause eventually heart damage, blood vessel damage, kidney damage, brain damage, and the like. At the next level, you have the cells become dysfunctional. There are different cells in the body. So the blood vessel cells are called endothelial cells. The immune cells become dysfunctional. So they cause the immune cells to attack your own organ cells instead of attacking foreign objects that attack self-protein and self-cells and membranes. Renal cell dysfunction, the kidney starts to become malfunctioning, and other tissues such as thyroid, cardiac cell dysfunction. So at the cellular level, different organs and tissues start to dysfunction as you start to develop this metabolic imbalance, the imbalance of micronutrients, imbalance of other organs. And as one cell system becomes dysfunctional, it affects other cell systems. And you have this complex cascade of events that causes more damage throughout the body. So the reason for the complexity here is that you can see that it creates a negative cascade of events. And so it builds on each other. Now, all of these things are happening before the doctor notices that you have an elevated blood pressure. Okay. So these biochemical reactions are going on throughout your life. They may occur for weeks, months, or even decades before you get the diagnosis. Another complex slide, but this abnormal biochemistry starts to spread throughout your body. It's almost like a cancer that's spreading. So you start with the biochemistry that happens inside the cells. It goes at the tissue levels. So cells and tissue become dysfunctional. Then it starts to spread. So this disruption can happen in the GI tract with disrupted microbiome. So the bacteria that lives in your gut becomes abnormal. So they cause leaky gut. So then more toxins get across the gut, causing more inflammation, causing more reactive oxidative stress. Also, things like salt intake, but more than just salt intake. As I said before, the intake of toxic foods, preservatives, chemical dyes, that happens here. That all contributes to this abnormal biochemistry that spreads throughout the body, and it causes blood vessel damage, it causes cardiac damage, etc. And so you have this impaired process. So disrupted microbiome, oxidative stress or chemical waste buildup, and inflammation or the biochemical fire, as we refer to it as, are the core things that contribute to the basis of high blood pressure. Now, neurohormonal factors. When you think of neurohormonal factors, how it's like a long distance communication from one organ to the other. The brain communicates to the blood vessels, the heart communicates to the kidney, and vice versa. So this happens through a neurohormonal process where you have nerves that reach throughout the body, and there's signals that communicate through the nervous system, whether it's the autonomic nervous system or the other forms of nervous system, or the hormones that are sent throughout the bloodstream or throughout other mechanisms that communicate one organ to another in a long distance fashion. So these neurohormonal factors, they tend to try to make an adaptation to the abnormal biochemistry, but oftentimes they lead to maladaptive changes and it can cause further harm. So again, multiple organs are interacting. If you have neurohormonal initiating organs, oftentimes it's at the brain, so the central nervous system, the kidney, and the adrenal gland. So they become biochemically unbalanced. So, for instance, the kidney may secrete a hormone called renin that can cause the blood vessels to vasoconstrict. The adrenal gland can put out hormones like epinephrine and norepinephrine, which can also increase heart rate and blood vessels constriction and blood pressure. So these organs, through a long distance neurohormonal response, causes increased blood vessels. In the situation with hypertension, the response organs are the blood vessels and the heart. The heart become hypertrophied, stiff. It may beat faster. Oftentimes, individuals with high blood pressure have high heart rate, and the blood vessels can constrict. So you can just get a glance at the complexities here. So if I give you a medication, it may only work in, say, this location. It may not affect reactions that are happening in other parts of the body. So multi-organ dysfunction. When you're dealing with high blood pressure, you're dealing with multiple organs. When I give you one blood pressure medication, I give you, say, a diuretic. Well, the diuretic may work at the kidney, but there's all of these other mechanisms that are going on that the diuretic may not affect. So the diuretic may have some effect on the elevated blood pressure, but it's not reversing this complex process that's still causing the damage. Maybe the diuretic lowers the blood pressure, but you have all of these other mechanisms that having damage on the heart, having adverse effect on the adrenal gland, and this process persists despite the fact that I may lower your blood pressure. This complex biochemical process may persist. And then the main organs that we see from a clinical standpoint is kidney, heart, and brain. Early on, you may see vision changes such as retinopathy, left ventricular hypertrophy or enlargement of the heart or thickening, protein leakage from the kidney. As a patient becomes more symptomatic, they start to get renal failure, coronary disease, chest pain, shortness of breath. Then you start to measure elevated blood pressures, atrial fibrillation or heart rhythms. You start to get palpitations. And then you start to forget where you leave the keys. So cognitive decline and dementia. So this is symptomatic. But just notice that this whole biochemical process is making its way through your body long before you're symptomatic. And then you get to end stage renal failure, you're on dialysis, you've had a heart attack, maybe in congestive heart failure, you may have a stroke, etc. And so at this point, you're trying to reverse things to get it back in this direction. That's when we have to work very, very hard. That's why I talk about other treatment regimens such as nutritional detox and other regenerative therapies, because it takes a lot more the further along you get to reverse it. And of course, long before you die, you may be sick and suffering in this latter stage. So I give you that information to let you know that hypertension is very, very complex. We'll measure your blood pressure. Oh, it's 140 over 90, or it's 120 over 80, or 120 over 70. It's good. But this underlying biochemical process is going on, and we can't measure these things in a direct sense. That's why you want to look at your lifestyle. And even though your blood pressure may be normal, you want to look at, okay, what am I doing? Am I drinking alcohol? Am I hydrating? I'm not exercising. We're drinking lots of processed foods, lots of junk foods. Okay, my blood pressure may be normal, but I'm contributing to the abnormal biochemistry. So at some point, the blood pressure may be elevated, or even without the blood pressure elevated, I may start to get some of the organ damage. I see lots of patients come in with a thickened heart muscle, enlarged heart, and they have normal blood pressure. Well, my blood pressure is normal. Yeah, but your heart's enlarged. Why? Because this abnormal biochemical process is contributing to this whole issue. So that's that issue. Now, what's the standard diagnostic approach? Essentially, take a history. If you had a history of elevated blood pressures prior to the diagnosis, sometimes people come in and say, well, my blood pressure is normal, but it was elevated. One day I went to the doctor. It was elevated when I went to the dentist. Well, that's a sign that the blood pressure started to become elevated sporadically. If you have a family history of high blood pressure, of course, that's going to, is a signal that you may be predisposed to it. Episodes of blood pressure with exercise. So some people's blood pressure is normal at rest. When we take them to the office and we do a stress test, the blood pressure shoots through the roof. That could be an early sign that, hey, you're having advanced blood pressure issues. On physical exam, eye exam, usually ophthalmologists may see the blood vessels directly. You can see changes there. Serial blood pressure measurements at home or in the office can pick it up. Sometimes a physical exam, things like a fourth heart sound can be picked up. Diagnostic evaluation, abnormal renal function on blood tests, sometimes enlargement of heart on chest x-ray, thickened heart on echocardiogram are signs of advanced in-organ involvement. And of course, if someone has a history of poor lifestyle, that's a setup for elevated blood pressure. So we look at these things on the history. This I'm not going to go into too much. This is the standard criteria the American Heart Association, American Stroke Association use. Normal blood pressure, systolic less than 120, diastolic less than 80. Elevated blood pressures, 120 to 129. These numbers can change depending on your hydration level. If you didn't sleep well, your pressure may be in the high range. So there could be some fluctuation in it. It's only when the blood pressure is sustained at these levels is when you get the formal diagnosis. So, but this is just a good reference to have. Now, what's the typical treatment? We have lots of medications in the allopathic realm. Medications, the vast majority of patients are treated with medications. The basic class of medication, they're diuretics, calcium channel blockers, ACE inhibitors, angiotensin receptor blockers. These are just medications that work at different levels and different mechanisms in the body. And they can be effective initially in the short term. And we use them in my practice from time to time, especially if someone has elevated blood pressure and we're working on the lifestyle. But you don't want to just stop at these medications. You really want to, although you control the blood pressure, you want to start working at the underlying process. So special procedures are usually for secondary hypertension. I won't go into it on this discussion. I may do a special talk on special secondary hypertension. Integrated treatments. Nutrition is going to be the core. Minimally processed plant-based diet, we use it all the time. We've had patients come in and the blood pressure come down pretty rapidly. We published this in the medical literature. You want to optimize hydration. Exercise is extremely important. You're going to start with light aerobic exercise and build your way up to high intensity training over time. Relaxation and meditation. Leisure walks outdoors, massages. And we use advanced integrative therapies such as plaque X infusions, infrared sauna therapy, ozone therapy to help the body reduce inflammation, oxidative stress. Now, here's the bonus section for you. Oftentimes I get in the messaging, people ask, how do I go about getting started on a detox? Well, there's some basic steps you want to take. It's pretty straightforward. It's all practical stuff. So first and foremost, preparing for a nutritional cleanse or detox, you want to identify plant foods that you like to eat raw. So even before you get started on the detox, okay, what do I like? You can list them. You can try some new things. I like oranges, I like apples, I like, whatever. So you want to build up the things and say, okay, I can start. That's part of your strategy. Identify resources of raw juices or smoothies. There may be juice bars near you. Maybe you have your own blender. You can practice making your own smoothies or whatever. So you want to look at the resources for that. Identify resources for gourmet raw plant foods. So there may be a raw vegan restaurant in your city. If you live in a large enough city, they may have, raw vegan pizza or raw vegan tacos that are delicious and savory, but it stays within the realm of detox. And you want to mark your calendar. Okay, plan ahead. Choose a date on the schedule when you're not traveling, ideally, when there are no family events. Ideally, want to shoot for 30 days. But this is something that you want to look at because setting yourself up for success is going to help out tremendously. And of course, prepare your environment. Try to get rid of the junk food. Try to get rid of the things that you crave, the things that are going to, trip you up, if you will. Let your family know that you're doing it. And maybe you shouldn't let your family know. It depends. And by all means, get started. So get started. I recommend you do at least 10 days. I really recommend you do 30 days. 30 days may be a lot, but at least 10 days. I have on my website a video where I walk you through a jumpstart. Just go to montgomeryheart.com/jumpstart. You can take a picture of this. It's on our website. And I walk you through a 10-day raw detox. There are recipes, menus, a calendar. I think this would be extremely helpful. There's no cost to it, no monetary cost. Now, there's a cost. You don't have to pay us anything, but the cost is your time and attention, your effort. But if you start this approach, it will give you a very good introduction to this. Now, granted, this is only the beginning. You have to work out a process over time, how you change your lifestyle. And we have a lot of other programs to help out in that regard. So I hope this was very helpful to you. If you're new to this channel, please subscribe. And of course, give us a thumbs up, a like button, so that helps with the algorithm. And of course, share this information with loved ones, because I think that this is going to be something that's going to be very helpful to you. But hypertension is a common problem, and it's a common contributor to heart disease, stroke, kidney failure, and morbidity and mortality in our country. So anyway, until next time, take care. Look forward to seeing you in the next video.